Welcome back to the ORE Pathway series. I hope you have enjoyed it. The last two videos. In video 1, we covered the overall roadmap. In video 2, we dealt with document verification in ORE Part 1. Now comes the most demanding stage of the entire process, ORE Part 2. So, this is not a written exam, it is a multi station clinical assessment designed to test real world competence, manual skills, communication, decision making, and the patient safety under pressure. With the updated GDC UCL delivery system, both the structure and the cost have changed significantly. That includes the current fee level of £6,967 per attempt. So in this video, the focus is practical, how each station works, what examiners look for, where candidates fail, and how to approach preparation without wasting time or your money. So now ORE Part 2 is divided into four independent assessment blocks. First, the Dental Manikin, second, the clinical OSCEs, and the third, diagnostics and treatment planning, and the fourth is medical emergencies. Each block evaluates a different dimension of clinical competence. Failure in one area can compromise the entire attempt depending on current rules, so preparation cannot be uneven. The structure is designed to simulate real clinical practice just in a controlled, high stakes environment. Now, coming on to the next slide, mastering the dental manikin. The manikin section is the most technique heavy component. You will perform a series of operative procedures on a phantom head, typically including restorative work, crown preparation, and endodontic assess or similar tasks. The examiner is not judging the final result, they are continuously assessing hand stability, birth control, tooth conservation, margin accuracy, ergonomics, and posture. Small technical errors matter. Over preparation, damage to adjacent teeth, or poor contouring can directly affect scoring. The key point that this is not a lab exercise, it is a simulation of clinical precision under exam pressure. Now, moving on to the next slide. Clinical OSCEs and treatment planning. The OSCE component is communication and clinical reasoning. You rotate through multiple stations, often involving simulated patients or structured tasks. Examiners focus on how you communicate, not just what you know. Can you explain a procedure clearly without jargon? Can you manage anxiety professionally? Can you obtain informed consent correctly under UK ethical standards? Alongside OSCEs, the diagnostic and treatment planning exercise assesses your structured thinking. You are given full case data, radiographs, photographs, and history, and expected to produce a safe, logical treatment plan. Marks are awarded for reasoning, prioritization, and adherence to evidence based UK clinical guidelines. So, here we will talk about the medical emergency station is non-negotiable for clinical safety. You are tested on immediate response to critical situations such as collapse, anaphylaxis, asthma attacks, or hypoglycemia. The BLS component requires correct CPR technique performed independently following UK Resuscitation Council protocols. After that, you are assessed verbally on emergency protocols and drug administration logic. So one important structure point is in some settings, failure in this block alone may not automatically mean failure of the entire exam. But this depends on current regulatory rules. Candidates should never rely on retake flexibility and must prepare for full competency. Coming at to the cost now, the financial reality. ORE Part 2 currently costs about 7,000 pounds per attempt. This increase reflects the infrastructure required to deliver a high fidelity clinical examination at scale. The exam is conducted using advanced simulation facilities, standardized patients, calibrated examiner panels, and strict quality assurance systems. The fee is not just for entry, it funds the entire operational framework that ensures clinical safety standards equivalent to UK dental practice expectation. Still, for many international candidates, this represents a major financial barrier and planning becomes essential. Coming to prepare effectively, each block requires a different strategy. For many coin work, repetition is the only reliable method. Precision comes from muscle memory. For OSCE's, communication training is critical. Practice explaining procedures in simple language to non-dental individuals. For treatment planning, focus on structured decision making, diagnosis, risk assessment, and sequencing. For medical emergencies, memorization alone is insufficient. You need rapid recall under stress aligned with official rustication algorithms. Now, coming booking availability has improved compared to earlier years due to expanded capacity under the new delivery model. However, the MyGDC system still operates on strict scheduling windows. Priority booking is typically given to candidates nearing expiry deadlines or under specific regulatory categories. For most candidates, access is first come, first served. The practical requirement is simple: maintain an active portal, ensure notifications are enabled, and be prepared to book immediately when slots open. So the ORE Part 2 represents the final clinical barrier before UK dental registration. It is demanding, expensive, and technically strict, but it is also structured and predictable when broken down properly. In the next video, we will move beyond exams and into practical career pathways, how to start working in the UK dental system while navigating registration routes and job structures. If this breakdown helped clarify ORE Part 2, engage with the series and use the comments to identify which stations feels most challenging. Preparation is not about intensity alone, it is about structure and consistency. See you in the next video. Till then, subscribe our channel and stay connected.